Hello everyone. Firstly, I would like to congratulate all of you that if you watched this video, that it means that you have finished the study on the basic theories. So from the basic theories, we discussed some philosophies, the physiological and pathological of our human body. Also, we have studied the etiology, pathogenesis, as well as the preventions. So those are purely theories. And when we see patients, we see a physical patient, the actual patient from the clinic, a human being. So from the theories to the patient, there's a gap between these two. From today, we are going to study the Chinese medicine diagnostics. This is the bridge from the theory to the clinical practice. So the Chinese medicine diagnostics is one of the most important disciplines in the acupuncture study. From the general introduction, we're going to use a few periods to talk about the general introduction. From the general introduction, we are going to give you a brief figures of what this subject looks like, what includes in the Chinese medicine diagnostics, the contents or the concept of the diagnostics. Also, we are going to introduce the basic principles that's used in the diagnostics. These principles can guide our daily practice in future. So after the general introduction, the study of this session, you will have a full picture of what Chinese medicine diagnostics study on and what's the content of them. So before we go to the details, I want to show you two short videos.
Hi, can I have some fruit, please?
哦，买水果是吧？好好好，你看是吧？给女朋友买一点，好不好？哎，你看，来，你看我们这橘子，甜过初恋，好吗？这一看就是最好的橘子。来，多买一点啊，多买一点，给父母啊、叔叔阿姨啊都买一点，好不好？你看我们这梨子多好，微量元素很多的，很补身体的，小伙子。来，多拿一点，好吧？这些都最好的，你看我都把最好的给你啊！来，再来个西瓜，这西瓜可甜了，来多买几个啊！来，哎呀，小伙子一共300块钱。
So I want you to remember this thing when we're going to talk about this. And also you can see how this gentleman choose the fruits.
一共49块钱啊。
Hi, can I have some fruit, please?
哦，买水果是吧？好，你看是吧？给女朋友买一点，好不好？哎，你看，来，你看我们这橘子，甜过初恋，好吗？这一看就是最好的橘子。来，多买一点啊，多买一点，给父母啊、叔叔阿姨啊都买一点，好不好？你看我们这梨子多好，微量元素很多的，很补身体的，小伙子。来，多拿一点，好吧？这些都最好的，你看我都把最好的给你啊！来，再来个西瓜，这西瓜可甜了，来多买几个啊！来，哎呀，小伙子一共300块钱。 一共49块钱。
The second video was about a gentleman seeing a Chinese medicine doctor, and he was filming in the actual practice. Let's see the video. This gentleman got the
我感冒了，
感冒了。
我的手。
So from here, the practitioner was feeding the pulse on the wrist
OK，
of the
没有
patient.
没有没有。
Also, the practitioner asked the patient to show his tongue. He was
这
seeing
边
the
没有
tongue.
很大的问题，只是我鼻子还有耳朵，有点不舒服。我刚刚坐飞机，还有我头痛。
头痛。
对。
So the
我之前感
patient
冒。
told quite a few symptoms. There's some discomfort. The doctor changed the hands to feel
眼睛那些
on the
胀
other
痛，
side of the
眼睛
hands.
有头痛，
头痛对。
还有
鼻子对鼻子有很多那个东西。
是吧？
So the doctor was asking that the eyes
好好的睡，
or
是
headache,
26岁。
some other patients.
没有。
不敢哈。
不敢。你可以给我那个不是动物的药。
没得动物。
谢谢你，谢谢，非常谢谢。
So this video shows us actual practice in our clinics. What happens when we see a patient? In this whole process, what has been included in this process? Firstly, there was conversation between the doctors and the patient. Right, the doctor was asking some questions. Also, the patient told the doctor some discomfort. So the conversation, the doctor feel the pulse on both hands of the patient. The doctor also saw the tongue of the patient. So what does this mean, and why the doctor need to do something like this in order to diagnose, to prescribe the prescriptions for the patient? These are the information, the contents that we need to study in our diagnostics. So as you can see, that the diagnostics, the full process here is actually from the patient, from the symptom to the treatment, which can be the herbal medicine from the prescription, or can be acupuncture treatments. But that's the process in between, the procedures in between, from the patient, the actual patient, to the treatments. That's something in our diagnostics. As we have seen from the video, that in our practice, the doctor, in order to conclude to a diagnosis for the patient, in order for the treatment, there were conversations. The conversations include the inquiries. So the doctor will ask the patient, how do you feel? That's why he was asking, how about the eyes? Do you feel thirsty or do you feel any headaches? So that's the inquiries. The doctor also asks the patient to show his tongue, and he inspects the tongue. In the meantime, he also inspects the facial color, although he didn't mention. The doctor feel the pulse, that's palpation. So as you can see from here, in order to diagnose, we need to identify the disease. But how to identify the disease? We need to gather the symptoms and signs from the patient. From the diagnostics, the contents of the diagnostics, we need to focus on the diagnostic methods, the techniques, how to gather the symptoms and signs, how to gather the information we need for our diagnosis, or for our theories, in order to get a conclusion from the patient. We need to gather information to support our diagnosis. That's the main contents we're going to study, which is the diagnostic method. You need to study how to find the symptoms, how to find the signs from the patient. So the four diagnostic methods are inspection, smelling and hearing, inquiry, and palpation. That's also why we, at the beginning of this year, when we said that conversation, when we see a patient, the consultation starts the moment the patient walks in the consultation room. That's because before we talk, we already saw the patient. We've already seen the patient, and that's the start of a conversation, because you see the movement of the patient, the shape of the patient, also the face color of the patient. That's from inspection. Smelling and hearing and inquiry, these sometimes happen together, because the hearing, you can hear the voice of the patient. You can hear the sound of normal noise from the patient, such as cough or weird sounds or hoarse sounds from the patient, and also from inquiry. During the consultation, during the conversation, you can hear the patient's voice. That's also from the hearing. You can ask some questions that's related to the consultation. You're also going to feel the pulse. You're going to feel some parts of the body if you have to. So these are the diagnostic methods that we're going to study in this subject. That's you're going to learn how to find the signs from the patient, and the symptoms, how to ask the symptoms from the patient. So from here, we need to, although we have already discussed in the basic theories, what's the difference between symptoms and signs. Symptoms are the discomfort that the patient will tell you. The signs refers to the abnormal, that's from the doctor's side to see the patient, such as the tongue or abnormal of the physical organs. So those are signs. So this is the first part of the contents of Chinese medicine diagnostics. We're going to study the diagnostic methods. The second part is the pattern differentiations. In the basic theories, we already studied that there are two key characteristics of Chinese medicine that are very different from other medicine. The first one is the concept of holism. The second is symptom differentiation. So when we use symptom differentiation and pattern differentiation, they actually mean exactly the same. So you can use either of them. The second characteristic is symptom differentiation and treatment variation. This actually help us to identify the patterns of the patient. Also, you help us to prescribe the principle of the treatments or prescribe the prescriptions of the treatments. So the symptom differentiation is another section of this diagnostics, because our treatments, acupuncture treatments, Chinese medicine treatments, we more based on pattern. We based on pattern. Here, we need to understand what's the patterns and disease. What's the difference between the patterns and disease? Pattern refers to the cause of disease, a certain period of the disease. The disease is the full cause of an ailment, which is from the beginning, how the ailment going to develop, and what's the prognosis of this disease, what's this ailment. So that's the full process, the full development of an ailment. That's the disease. Pattern refers to a certain period of the disease. Especially this pattern refers to the period or the course of the disease. That's when the patient was seeing you. So pattern, we actually conclude the pattern from the consultation when the patient seeing us, such as the patient got red face, red tongue, yellow coating. This group of symptoms or signs we can conclude to a pattern, but this pattern can be any kind of disease. We can't conclude to a disease according to these signs only. So in this study of the diagnostics, we're going to study how to differentiate the patterns according to the symptoms and signs. The disease differentiation, although it's also very important, but it's not in the diagnostics. We're going to study the therapeutics of acupuncture, which we're going to study the disease. We're going to study the full development of disease, such as flu, such as stroke, stomach ache. That's the disease differentiation. We're going to study what's the cause of the disease, and then what's the pathogenesis, what's the etiology, what's the pathogenesis, what's how to prevent the disease. So that's the string of the disease differentiation, disease prevention. And here now we're going to study the patterns. The patterns such as the heart yang deficiency, stomach fire, or wind cold attack the lung. So that's the pattern differentiation. We talk about the heart deficiency. So we're going to go to the next slide, but you can just remember here we got a medical, writing the medical records, because once this video, once I go to the next slides, I won't be able to reverse. So let's remember the third perception. Here are some examples of the patterns. So the hot-yang deficiency pattern, the stomach heat pattern, the wind cold attacks the lung pattern. So these are the patterns we're going to use quite a lot in future. These are the patterns as the conclusion from the 4 diagnostic method, the information we gather from the diagnostic method. So from the name of here, we can see where is the disease, the heart, the stomach, the lung. Also, we can see what's the nature of the disease, yang deficiency, heat, wind cold, the pathogen. So these two are actually the main aspects that we are differentiating. What do we differentiate from the syndrome differentiation? We want to differentiate the location of the disease, the nature of the disease. So each pattern will include at least two: the location, where they are, the nature, what kind of nature. So that's the syndrome differentiation. And the syndrome differentiation depends on the symptoms and signs, such as the pictures here. When you see a lady holding the abdomen, you can think about that the lady might have abdominal pain. The gentleman was holding the chest. He might suffer from chest pain. This is from the inspection, observation. When you will see some signs and symptoms. So from the diagnostic study, we actually learn to gather the symptoms and signs, and also from the syndrome differentiation and disease differentiation. We are actually trying to understand the knowledge behind the symptoms and signs, the reason behind the symptoms and signs. And from the disease differentiation, although we're not going to study in the diagnostics, we're going to study in the therapeutics. The disease we're going to study, such as disease A, we're going to study what's the onset, what's the pathogens, what's the cause, what's the pathogenesis, and then what's the development of certain disease, what's the prognosis of disease. So these are disease A, that's the development of the disease. The pattern differentiation, at this stage, the disease was keep developing, but at this stage, the patient don't feel well. The patient doesn't feel well, and at this stage, he came to see you. And from here, we will gather the symptoms and signs from this certain period. And from this certain period, we conclude to a pattern. So as you can see, the pattern and the disease differentiation is different from different direction. We try to understand the disease from different direction. One is vertical, from the beginning to the end. The other is horizontal. We study from certain period. At this stage, what happens to the patient? At this period, what happened to the patient? We don't care how the disease is going to develop. That's the study in the therapeutics. We want to understand the development of the disease. But from the pattern differentiation, we want to understand the patterns at this certain period, we want to change the pattern here. That's how to stop the development to the end. So that's our treatments in Chinese medicine. And also until here, you will see that whenever I talk about the diagnostics method, the 4 diagnostic methods, the pattern differentiations, that's the 2 important aspects that we're going to study here in the diagnostics. And I always mentioned about the theories. How do we understand the symptoms and signs? What's the relationship among different symptoms and signs? Or what's the knowledge? What's the reason behind the symptoms and signs? What's the connection between the yellow coating, the chest pain? These we always use the theories to understand. That's also why we study the theories at the beginning, and then we go through the diagnostics. So from here, you will understand that the definition of the Chinese medicine diagnostics is actually the study how to identify the disease, how to identify the patterns according to the basic theory. So we use the basic theories, the knowledge from the basic theories to understand the patterns and the disease. And also we learn how to gather, how to find the symptoms and signs. That's from the diagnostic methods. So from here, from this course, from this subject, there are 2 main content that we're going to study. That's the diagnostic methods. You need to find out what are the symptoms and signs. Also, you need to understand how to analyze the symptoms from the theories we have studied. So these are the 2 aspects we're going to study, we're going to focus on in diagnostics. The last part that I ask you to remember, because we can't reverse the slides, we can't move back to the slides, that's the medical writing. Keeping the medical case is one of the responsibility for a practitioner. It can benefit the patient's treatment. It also can benefit ourselves in terms of reviewing certain treatments. The medical case also very important legal information. So from this study, we also need to learn how to write a proper medical case. Although the medical case writing is not only related to the diagnostics, but in our Chinese medicine study and acupuncture study, we're going to study the writings from diagnostics. There's not a lot of theories behind the writing, but from here, so it's very simple of this session, the last session of the diagnostics. All what we need to do is to learn the formats, to learn how to write a proper case. So that's the 3 aspects that we're going to study in the diagnostics. The first session is the diagnostic method. The second session is the pattern differentiation. The last session is the medical case writing. And the first 2 are more important. So because this information in diagnostics are quite complicated, that's why we spend quite a few times to give you a brief layout of the diagnostics, what will be included in this subject. And from the next video, we are going to talk about some rationales of diagnostics. Thank you, guys.